Illness in a baby can be a very subtle thing to pick up. It might be something like not feeding well. There might be a fever. The baby might be a little less active and a little less interactive with the family. There might be other signs, vomiting, diarrhea. These are the kind of things that would be red flags and at least cause the mom to call her doctor and find out if she should come in.
What's uncommon is they shouldn't be coughing. If they're coughing in the first month, get them checked. If they're projectilely vomiting, which you start to see within the first couple months of their life, get them checked. That could be a pyloric stenosis. If they're yellow and the yellow doesn't go away, that could be a form of jaundice. Have the pediatrician evaluate them for that. You know, they won't focus on you. Their eyes will kind of look around. If you think your baby is too hot, you need to take a temperature. We recommend rectal. Rectal temperature is the most important. If the temperature is over 100.4, that's considered a fever.
Development, as I mentioned, is very, very important. Babies develop very quickly. And so in a couple of months, if your baby's not smiling at you, not looking at you, not interacting with you, then it's probably a good reason to visit your pediatrician.
Right now, they do newborn screenings for hearing. Don't expect that the baby will hear you right away. You know, that's very common for the baby to just kind of look like he's just lying there seeing what's going on. So it's kind of a little nerve-wracking for moms in the first month. But again, have the pediatrician reassure you and make sure everything's okay.
We also look at the all-important development of the baby. You know, their gross motor development, their fine motor development, their interaction with the family, their language development. These things are the bread and butter of being in a pediatric practice, and these are the things that we like to look at and share with the families. You know, we like to point out how the baby's developing, you know, how they're smiling now, how they're reaching out for the mom, and the parents really enjoy, you know, us commenting on these things. It's a very exciting time and a very intimate time for the family. I typically recommend that they not take their baby out for at least a month or so. That gives them a chance to grow a little bit bigger and stronger and be able to deal with the outside world a little bit better. If the family needs to go out and go to the store, you know, they can take turns, or they can send an older sibling out, or perhaps relatives can run errands for them. But I think it's really important for the baby to stay in and the family to develop their routine. There'll be plenty of time to take the baby out at a later date and to show them off to friends and family.
If you live in an environment with high extremes in temperatures, whether it be heat or cold, we don't recommend it. We also don't recommend you taking your child out to a facility where there's going to be lots of people, because those first 30 days of the baby's life is very crucial, and they could still be susceptible to infection.
Restaurants and places like that where there's lots of people, you know, they just don't belong. And they really don't need to go to the movie theater. One of the things that drives me crazy is to see a baby in a car seat at the movie theater on, you know, just on the floor there. And it's very, very loud in the movie theater, and there's lots of people and there's germs, and they just don't need to be there.
When you come home from the hospital, you're going to be very much inbound because you're just recovering and the baby's so small. But exercise is healthy for you, and it's good for the baby to get some outside fresh air. So I say to the families, test out that new buggy. Go for a little walk around the block.